The doctors knew they had a challenging case before them. They needed to understand how these different parts of his life intertwined to affect his health so severely.
Mr. Ibrahim's medical history was complex. He had spent many years of his youth working in the phosphate mines. The dust was a constant companion in those deep tunnels. It settled in the lungs, unseen but persistent. Later in life, he was also diagnosed with rheumatoid arthritis. This condition caused his joints to ache and swell. Now, a new, more pressing concern had brought him here. His lungs were failing him.
Among the many faces in the waiting area was Mr. Ibrahim. He was an older gentleman, his breathing noticeably labored. His wife sat beside him, her hand resting gently on his arm. She looked worried, her eyes following every movement of the medical staff. Mr. Ibrahim carried the quiet dignity of someone who has lived a long, hard-working life. He had come to Kasr Ainy seeking answers. He hoped for relief from the tightness in his chest. The simple act of breathing had become a daily struggle for him. The journey to the hospital had been tiring.
The sun was just beginning to climb over Cairo. Inside Kasr Ainy Hospital, the day was already in full swing. Corridors bustled with purpose. Nurses moved quickly, their footsteps a familiar rhythm. Doctors, their faces etched with focus, reviewed charts and consulted with colleagues. The air hummed with a quiet urgency. This was a place of healing, a sanctuary for those in need. Every person here played a vital role. They were dedicated to easing pain and fighting illness. The weight of responsibility was evident, but so was their unwavering commitment. The teams at Kasr Ainy are renowned for their skill. They are also known for their deep compassion. These medical professionals see countless patients each day. Each patient brings a unique story, a unique battle. The doctors listen intently. They observe carefully. They understand that medicine is more than just science. It is an art that requires empathy and human connection. They work long hours, often under immense pressure. Yet, their dedication never wavers. Their goal is always the same, to provide the best possible care. They are a beacon of hope for many.
The team considered if the arthritis was a contributing factor, or was it primarily the years of dust exposure in the mines? Perhaps it was a tragic combination of both. They needed to consider all possibilities to form an accurate diagnosis. The collaboration was essential.
Dr. Ali, a rheumatology expert, offered his insights. He explained how rheumatoid arthritis, an autoimmune disease, can sometimes affect the lungs. The body's immune system mistakenly attacks healthy tissues. This can include the delicate tissues of the lungs, leading to inflammation and potential scarring.
Next, the team carefully reviewed Mr. Ibrahim's old medical records. They pieced together his health journey over the years. His records detailed his long history of working in the mines. They also documented the onset and progression of his rheumatoid arthritis. The doctors noted how his breathing problems had gradually worsened. What started as a slight cough years ago had escalated. Now he experienced shortness of breath even with minimal exertion. His previous treatments for arthritis were also considered. They looked for any clues that might connect these different health issues.
Dr. Fatima traced the delicate web-like patterns with her finger. "See this honeycomb appearance here?" she asked, her voice low. "And these ground glass opacities?" The other doctors nodded. These were telltale signs of a serious lung condition. The images painted a picture of lungs that had become stiff and less able to expand. This made it difficult for oxygen to pass into the bloodstream. Every breath Mr. Ibrahim took was a fight against this unyielding tissue.
Dr. Fatima, a senior pulmonologist, led the team. She gathered her colleagues in a quiet room. The room was dominated by a large light box. Mr. Ibrahim's CT scans were displayed, glowing with stark images of his lungs. The doctors leaned in, their expressions serious. They pointed to areas of concern. They discussed the patterns they saw. The images revealed widespread damage. It was clear that Mr. Ibrahim's lungs were struggling significantly. These scans were a crucial piece of the puzzle. They offered a window into the silent battle raging within his chest. The CT scans showed extensive scarring. This scarring is known medically as fibrosis.
Dr. Fatima looked at her team. "This is a difficult situation," she said softly. "Our priority now is to ensure Mr. Ibrahim understands, and that we provide him with the best possible support and care." Their shared purpose was clear.
A quiet understanding settled over the room. The doctors felt the weight of the diagnosis. They knew what it meant for Mr. Ibrahim and his family. There was a shared sense of empathy. These were not just images on a screen or notes in a file. This was a person's life profoundly affected by illness.
The presence of rheumatoid arthritis further complicated Mr. Ibrahim's case. While the mining exposure was a strong suspect for the fibrosis, the arthritis could also play a role. Autoimmune conditions like rheumatoid arthritis can sometimes trigger inflammation in the lungs. This inflammation, if chronic, can also lead to scarring. It was possible that both his work environment and his underlying autoimmune condition had contributed to the severe state of his lungs. The doctors acknowledged this complexity. It meant his treatment plan would need careful consideration of all these elements.
The team then discussed the profound impact of Mr. Ibrahim's work history. Those long years spent in the phosphate mines were a critical factor. Inhaling fine particles of silica dust, common in mining, can lead to a condition called silicosis. Silicosis is a lung disease that causes inflammation and scarring. This scarring is a form of pulmonary fibrosis. The damage from the dust accumulated silently over decades. It was like a slow, invisible injury, leaving permanent scars on his lungs. The connection seemed undeniable. His labor to provide for his family had unknowingly taken a toll.
After careful deliberation, Dr. Fatima voiced the team's growing suspicion. "I believe we are looking at idiopathic pulmonary fibrosis," she stated. The term sounded complex, but she broke it down for the junior members of the team. "Pulmonary means it affects the lungs," she explained. "Fibrosis means scarring. And idiopathic means we often don't know the exact single cause. In simple terms, Mr. Ibrahim's lungs were becoming progressively scarred and stiff. This scarring was making it harder and harder for him to breathe. It was a serious and life-altering diagnosis."
The team at Kasr Ainy understood that their role extended beyond medical treatment. It encompassed providing solace and guidance through some of life's most challenging moments. They were ready to help Mr. Ibrahim navigate the path ahead with dignity.
Finally, they decided that Dr. Fatima, as the lead pulmonologist, would speak with Mr. Ibrahim and his wife. She would be accompanied by Dr. Ahmed for support. They would choose a quiet, private space for the conversation. Their goal was to provide information with kindness. They would ensure the family had ample time to process the news and ask questions.
Dr. Ali added, "We should also highlight his strength. He has faced challenges before with his work and his arthritis. We will face this with him too." The team agreed that presenting a united and supportive front was essential. They wanted the family to know they were not alone.
The doctors also prepared themselves for the emotional impact of the conversation. They anticipated the questions Mr. Ibrahim and his wife might have. They knew there would be fear, sadness, and perhaps anger. They needed to be ready to listen patiently. They would offer comfort and reassurance where possible.
They discussed how to gently explain that while there is no cure for IPF, there are ways to manage the symptoms. They would focus on treatments aimed at slowing the disease's progression. They would also discuss ways to improve his quality of life. This included oxygen therapy if needed and pulmonary rehabilitation.
Dr. Fatima emphasized the need for simple language. "We must explain what IPF is in terms they can understand," she advised. "We need to avoid jargon. We will tell them that his lungs have developed scarring, which makes breathing difficult."
Dr. Ahmed, a younger doctor on the team, listened intently. He was learning not just the science of medicine, but also the art of compassionate communication from his senior colleagues. This human aspect was just as crucial as the diagnosis itself.
The medical team began to strategize how they would communicate this serious news. They knew that delivering a diagnosis of idiopathic pulmonary fibrosis required great sensitivity. It was important to be honest and clear, but it was equally important to be compassionate. They wanted Mr. Ibrahim and his wife to feel supported, not overwhelmed.